When we talk about breast diseases, the common reasons why patients seek consult are because of breast lumps, breast pain, some because of skin changes in the breast, a nipple discharge, or sometimes they feel a lump in the axillary area or armpit.
The common threats or the common problems that we encounter in women, usually they come with irregular menses and infections. These are the very common. There are so many women who complain of irregular menses or abnormal menses, be it a teenager or woman in her 40s or 50s, no? These are the common ages. But at any age, we can have this irregular menses, which we call abnormal uterine bleeding. So, for example, in a teenager, she has her menarche at around 13, 14, and then they encounter that the child or the teenager has bleeding for several weeks already. So anyway, you have to, as a parent, sometimes you have to monitor your children, ask them if they're menstruating properly, and then bring them to the doctor for consultation, because sometimes they're shy or they don't know, they have no idea that the bleeding is abnormal, so they keep it to themselves. In other cases, there's also those who do not have menses, which is also common in teenagers. So, if it's prolonged, they don't have menses for a long time, maybe they really need check-up. But if it's only just a few months of no bleeding, you can observe like for a month or 2 months. No? And then in the adults, I would say that normal menses generally is a week. It lasts for a week. And then majority of the time, although it of course differs from each woman, no? But majority of the time, they consume approximately an average of 3 to 4 pads per day. So, because in the books what they say is you should have at least the average bleeding is around 80 ml. So anyway, it's difficult to measure 80 ml. So what we do is we count the pads. So like I said, if majority of the time and the average is 3 to 4 pads, if you're exceeding that for several days, definitely you have very strong or heavy bleeding, which needs consultation. And then if, for example, it exceeds the 1 week, you definitely need to go for consultation, because a lot of these women, they think that, for example, it's nice to have a very good flow, but the thing is, they think that the good flow is the bleeding should be very strong, which is not true, because when interviewing patients, majority of the time, like I said, they only consume 3 to 4 pads, or let's just say 5 pads. Other than that, if it's like 7, 8, sometimes they even use diapers already, that's very heavy bleeding. It's not okay. Consult your doctor. And then most of the time also, for example, cancers, no, the like uterine cancer or endometrial cancer and cervical cancer, majority of the time, the symptoms are also heavy bleeding. So if you are in the menopausal age and you have concerns about your menses, it's better to be safe, so consult your doctor, your OB/GYN.
For us breast surgeons, we recommend women ages 40 and above to have their mammogram starting age 40. This is to be done yearly. We actually only have the 2 basic, no? We really require pap smear for all women. Usually, it starts at the age of 21 years old or 3 years after the
first sexual contact. And then, so starting at age 21 or 3 years after sexual contact, and then in the Philippines, they're recommending every year, no? So every year until you're around 60 plus or until 70, like that. When you're at that age already, around 70s, late 60s, if you have 3 consecutive normal pap smears, you can already stop, no? Discontinue. But from that time, in your 20s to your late 60s, you really have to have the regular pap smear. No, it's that important. The misconception is about pap smears is they think that pap smear is linis. No, it's not linis. It's a screening test for cervical cancer. That's why I always emphasize that it's screening test for cervical cancer, and all women have the risk or can have the risk to get cervical cancer, because cervical cancer is acquired. You can get it through sexual contact. The main cause is virus, HPV virus, human papilloma virus, and that's the importance of pap smear, so that we can screen if the woman is developing the disease already or has the disease. Okay, and then the mammogram, usually we start the mammogram at around 40 years old or 50, depending on your doctor actually. But if, for example, you have family history of breast cancer, it's definitely advisable to start early. So we start with the self-breast exam, which is done by the patient herself. She can do it every after menses, and then she can palpate her own breast, like she can do it in the shower. It's either so standing up after she has soaped her body already, no, because it's easy to palpate the breast, or she can do it lying down, whichever way she prefers. The important thing is to check the breast. However, the limitation of self-breast exams is you will only be able to palpate masses that are already big. So this is the reason why we have the mammograms and the ultrasound. So they go hand in hand usually, and in some cases, in one patient, you will really need to do a mammogram and an ultrasound at the same time. But whichever the case, we usually recommend this at around the 40s up to 50s on a yearly basis also. Stress is very disruptive to everybody's health. May the person be a woman, a female, or a male, no? Anyway, for females, of course, stress can cause a lot of problems. It can be a factor in having the irregular menses, or the patient can get anxious, nervous. Stress can make you gain weight, lose weight. So it's very important. And because knowing this, we should encourage all women to have a healthy lifestyle. So what is this healthy lifestyle? It consists of course, the well-balanced diet and enough exercise, because as they say, if we have both of this and enough sleep, we will be able to manage our stress. And then aside from this, we can also advise our patients to seek or find something or a hobby or to manage their stress, because stress is really harmful to our body. When we plan to get pregnant, or number one, it's really better to plan pregnancy. instead of just spontaneously getting pregnant. So number one, plan it. Because when you plan it, you'll be able to have a well-balanced diet, better lifestyle with good exercise, sleeping also. We need enough sleep, 7 to 8 hours a day. And then aside from that, we can also have, for example, vaccinations that are needed so that we won't get sick during pregnancy. There are, if for example, like chickenpox or measles, no, we have a vaccine for that, MMR, but you cannot give MMR during pregnancy. So if you want to have a healthy pregnancy, you can have the vaccinations before getting pregnant. And then once cleared by your doctor, you can already plan on getting pregnant. And then aside from that, very important, like I said, the well-balanced diet. So there are nutritional deficiencies that can occur during pregnancy, like iron deficiency anemia and folic acid deficiency, which can be corrected by diet alone. So if we eat properly months before our planned pregnancy, so we can prevent these deficiencies or nutritional problems, no? And then, like the common misconception among Filipinos or Filipinas is that they think that as soon as a woman gets pregnant, she has to just rest. No, she cannot do any kind of work, which is actually not true. We, over the past years in different cultures, different countries, we see that women stay active during pregnancy. This is actually not bad. We actually need the pregnant woman to still exercise, although the amount of exercise decreases and the intensity of the routine is also decreased in a pregnant woman. However, like I said, she still has to stay active, no? Unless there are problems in her pregnancy preventing physical activity.
With regard to breast diseases, we encourage every woman to practice self-breast examination, for she is the only one who can detect whether there is a problem, or if she has something she isn't sure about, she can immediately seek consult to our breast center. Okay, our breast center here in the Medical City Clark caters different specialties for each and every breast patient. Okay, always remember that early detection saves lives. I'm Dr. Lea Pineda, breast surgeon.
I'm Dr. Philina A, OB-Gynecologist, your partner in health.